Good day, I'm Hanz Nicole from BSN-3D Block D, and for this return demonstration, I will be performing the cranial nerve assessment. For the assessment, verify the doctor's order, check the client's level of consciousness and level of understanding and knowledge about the procedure, check the availability and functionality of the needed materials, and lastly, assess the mental status or the client's ability to participate in the procedure. For the planning, if possible, determine whether screening or complete neurologic examination is indicated. This impacts the preparation of the client, equipment, and timing. Then, prepare the following equipment: piece of cotton to assess light touch sensation, sterile safety pin for tactile discrimination, but for this return demonstration, I will be using a broken barbecue stick, sugar, salt, lemon juice, and quinine flavors, tuning fork, tongue depressor, and again, I will be using a spoon for this since I was not able to obtain all of the following materials needed. The next is the paper clip. Next, we need the pen light, clean gloves, coffee, and vanilla to test the olfactory nerve, Snellen's chart, tissue that is used during the assessment for the olfactory nerve, and lastly, we have the paper cards that will be used during the confrontation test. Introduce yourself and verify the client's identity. Explain to the client what you are going to do, why it is necessary, and how the client can cooperate. Good morning, ma'am. I'm Hanz Nicole from BSN-3D, and I will be your student nurse from 7 a.m. to 3 p.m. May I know your name, ma'am?
My name is Juno Cyrus,
How about your date of birth?
January 1, 2000.
Okay, thank you. And for this morning, I will be assessing your motor and sensory function using the materials you see here on this table. And as we go along in the procedure, I will be instructing you on how you will do the procedure with me. Is that okay with you?
Okay.
Perform hand hygiene and observe other infection control procedures. Then, provide for client privacy by closing the curtains or closing the door to the room. Inquire if the client has any history of the following: presence of pain in the head, back, or extremities, as well as the onset and aggravating and alleviating factors, disorientation to time, place, or person, speech disorders, any history of loss of consciousness, fainting, convulsions, trauma, tingling or numbness, tremors or tics, limping, paralysis, uncontrolled muscle movements, loss of memory or mood swings, problems with smell, vision, taste, touch, or hearing. To assess the first cranial nerve, which is the olfactory nerve, we must ask the client to close their eyes and smell and identify different mild aromas such as coffee and vanilla. Grab a tissue, you can blow your nose, and you can throw it here. Okay, occlude one nostril and you will smell this first and then this. Can you smell? What is it?
It smells like
To assess the second cranial nerve, also known as the optic nerve, ask the client to read the Snellen's chart and assess the visual fields using the confrontation test. In reading the Snellen's chart, the client must stand 20 feet away from the chart and take 3 readings. The readings for the right eye, then the left eye, and using both eyes. Then, please cover your right eye and read the chart, please. one card and have her occlude her right eye while you occlude your left eye. Then please look straight in my eye only and don't look at my fingers. Then tell me when you see my moving finger.
Yes. Yes.
Okay, the other eye please.
Yes. Yes.
Okay, very good. To assess the third cranial nerve, also known as the oculomotor nerve, we must assess the pupil reaction using the acronym PERLA, which stands for the pupils are equal, round, reactive to light, and can accommodate objects. Okay, first to test the reaction to light, please look at me and then look straight over there in that base. And then this one. Please look at the pen line. Look straight in the pen line. Okay, very good. To assess cranial nerves number 4 and 6, also known as the trochlear and abducens nerve, assess the 6 ocular movements. Stand 1 feet away from the client and have the client follow the pen line without moving her head. And assess for any jerking or smooth movement. A normal result will be a smooth movement of the eye. 5, 1, 2, 3, go. Cranial nerve number 5, also known as the trigeminal nerve, assess the blink reflex, light sensation, and deep sensation. To test the blink reflex, while the client looks upward, lightly touch the lateral sclera of the eye to elicit the blink reflex. Okay, look upward and look over there. Other eye, please. Look over there. To test the light sensation, have the client close their eyes and wipe a waste of cotton over the client's forehead and paranasal sinuses. Please say yes when you feel the cotton touching your skin.
Yes. 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 Yes.
Okay, open your eyes. Test the deep sensation. Use alternating blunt and sharp ends of a safety pin over the same area. But for this return demonstration, I will be using a broken barbecue stick. Then, please close your eyes and tell me when you feel a sharp, blunt object. Or you can say don't know if you cannot cipher between. 1, 2, 3, 2.
Sharp. Blunt. 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 Sharp. Blunt.
To assess the 7th cranial nerve, also known as the facial nerve, ask the client to smile, frown, raise eyebrows, puff out cheeks, and close the eyes tightly. Okay, all good. Then, ask the client to identify various tastes placed on the tip and sides of the tongue, such as sugar and salt, and identify areas of taste. Yes, please. What does it taste?
It tastes with
You can please rinse your mouth. Have your gumroll here. And taste, please. Does it taste?
it tastes bitter.
Very good. To assess the cranial nerve number 8, also known as the auditory nerve, assess the client's ability to hear the spoken word and the vibrations of the tuning fork. Okay, ma'am, I'm going to include one of your ear and tell me the words that I'm going to whisper.
36.
Okay, for the other ear.
69.
Okay, that's good. So for the next test, I will be using this tuning fork and I will place it in 2 positions and tell me later on which position sounds louder, okay?
Okay.
Okay, for this first position, tell me when the vibration stops, okay?
Okay.
Position A.
It's gone.
This is position B.
It's gone.
Okay, which is louder?
Position B.
Okay, that's good. And then for the last test, tell me in which ear does it sound louder? This ear, that ear, or just in the middle?
The middle one.
Okay. To assess cranial nerves number 9 and 10, also known as the glossopharyngeal and vagus nerve, apply taste on the posterior tongue and ask the client to move their tongue from side to side and up and down. Okay, protrude your tongue, please. Okay, open. Okay, what does it have?
It tastes sour.
Okay, please rinse your mouth. Posterior, please. Okay, thank you. And gargle. And another taste, protrude your tongue. What does it have?
It tastes like strawberry.
Okay, then protrude tongue again. Move up and down, side to side. And in addition to assessing cranial nerve number 10, assess the client's speech for any hoarseness. Salta ka.
Hot dog.
To assess the cranial nerve number 11, also known as the accessory nerve, ask the client to shrug her shoulders against resistance from your hands. And then ask the client to turn the head to the side against resistance from your hand. And repeat to the other side. To assess the last cranial nerve or the hypoglossal nerve, ask the client to protrude the tongue at midline and move it from side to side. Okay na. Good. After the assessment, evaluate the patient's response to the procedure and document the procedure and other important data on the client's chart. And this ends my demonstration. Thank you for watching.